Question 1. Investigation of a patient undergoing IGIT for prostate cancer reveals a consistent 3 mm anterior shift in the patient's setup on the daily cone beam CT compared to the planning CT. The treatment plan has established institutional tolerances for setup errors. What is the most appropriate immediate course of action? Option A. Adjust the treatment beam angles and couch position based on visual estimation from the IGIT images to compensate for the observed shift. Option B. Proceed with treatment delivery as planned, assuming the deviation is within acceptable limits without further verification. Option C. Verify the accuracy of the imaging system and assess the magnitude of the setup error against institutional tolerances. If the error exceeds tolerances, correct the patient's setup and re-image before delivering the treatment fraction. Option D. Immediately initiate a full replanning of the patient's entire treatment course due to the observed shift. Correct answer is C. Verify the accuracy of the imaging system and assess the magnitude of the setup error against institutional tolerances. If the error exceeds tolerances, correct the patient setup and re-image before delivering the treatment fraction. Explanation. Scenario analysis. This scenario presents a common challenge in modern radiation oncology, ensuring the accuracy and safety of IGIT delivery when unexpected deviations occur. Professional challenge lies in balancing the need for timely treatment with the imperative to maintain treatment integrity and patient safety, all within the strict regulatory framework governing radiation oncology practice in Europe. The physician must critically evaluate the significance of the observed deviation, consider the potential impact on treatment efficacy and toxicity, and make an informed decision that upholds the highest standards of care. Correct approach analysis. The correct approach involves a thorough, systematic evaluation of the IGIT deviation. This includes verifying the accuracy of the imaging system, assessing the magnitude and direction of the patient setup error, and determining if the deviation exceeds predefined institutional tolerances. Crucially, it requires consulting the treatment plan and relevant clinical guidelines to ascertain the potential impact of the error on the prescribed dose distribution to the target volume and organs at risk. If the deviation is significant and compromises the planned dose delivery, the appropriate action is to correct the patient setup and re-image before delivering the treatment fraction. This approach aligns with the fundamental principles of radiation oncology, emphasizing precision, safety, and adherence to the prescribed treatment plan, as mandated by European directives and professional guidelines on quality assurance in radiotherapy. It ensures that the patient receives the intended therapeutic dose while minimizing the risk of underdosing the target or overdosing critical structures. Incorrect approaches analysis. One incorrect approach is to proceed with treatment delivery without investigating the deviation, assuming it is within acceptable limits without verification. This represents a significant regulatory and ethical failure. It bypasses essential quality assurance protocols designed to prevent treatment errors and could lead to subtherapeutic doses to the tumor or unintended irradiation of healthy tissues, potentially compromising treatment outcomes and increasing toxicity. This violates the principle of ALARA, as low as reasonably achievable, in terms of unnecessary dose to healthy tissues, and the principle of delivering the prescribed dose to the target. Another incorrect approach is to immediately replan the entire treatment course based on a single, unverified deviation. While replanning might be necessary in some circumstances, it is an overly aggressive and inefficient response to a potentially minor setup error. This approach fails to consider the established tolerances for IGIT and the established protocols for managing setup deviations. It can lead to unnecessary delays in treatment, increased workload, and potential patient anxiety, without a clear clinical justification based on the magnitude of the error. Ethically, it may also represent an inefficient use of resources. A third incorrect approach is to adjust the treatment beam angles or couch position based on a visual estimation from the IGIT images without quantitative verification or adherence to established protocols for error correction. This is highly subjective and prone to significant error, as visual assessment can be misleading. It directly contravenes the requirement for objective, evidence-based decision-making in radiation oncology and disregards the established procedures for ensuring accurate patient positioning, which are critical for the efficacy and safety of IGIT. This approach demonstrates a failure to adhere to established quality assurance and safety standards. Professional reasoning. Professionals should adopt a structured decision-making process when encountering IGIT deviations. This involves 1. recognizing the deviation and its potential implications. 2. Activating established institutional protocols for IGIT error management. 3. Quantitatively assessing the deviation against predefined tolerances. 4. Consulting the treatment plan and relevant clinical expertise. 5. Making a decision based on the assessment, either proceeding with treatment if within tolerance, correcting the setup and reimaging if the deviation is significant, or escalating for further review if the situation is complex or uncertain. This systematic approach ensures patient safety, treatment accuracy, and compliance with regulatory requirements. Question 2. What factors determine the most appropriate and effective immediate response by radiation oncology staff when a significant radiation source is unexpectedly found to be unsecured or malfunctioning within a clinical area, considering European regulatory frameworks for radiation protection and emergency preparedness? Option A. The immediate attempt to manually secure or repair the malfunctioning radiation source by the first responder, without waiting for specialized personnel or established protocols. Option B. The delay in reporting the incident to internal safety officers until a full assessment of the potential financial implications can be made. Option C. The immediate activation of the facility's predefined emergency response plan, prioritizing patient and staff safety through containment and controlled access, followed by prompt notification of the radiation safety officer and relevant medical teams, and clear communication with all affected parties. Option D. The immediate evacuation of all non-essential personnel from the entire facility to minimize potential exposure, regardless of the specific location or severity of the incident. The correct answer is C. The immediate activation of the facility's predefined emergency response plan, prioritizing patient and staff safety through containment and controlled access, followed by prompt notification of the radiation safety officer and relevant medical teams, and clear communication with all affected parties. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the inherent risks associated with radiation oncology emergencies. The primary challenge lies in balancing the immediate need for patient safety and containment of potential radiation hazards with the complex logistical and communication requirements of a large healthcare institution. Rapid, accurate decision-making is paramount to prevent harm to patients, staff, and the public, while also ensuring continuity of care for other patients. The potential for panic, misinformation, and delayed response underscores the need for well-rehearsed and clearly defined emergency protocols. Correct approach analysis. The correct approach emphasizes a multifaceted response that prioritizes immediate patient care, robust communication, and adherence to established European regulatory frameworks for radiation protection and emergency preparedness. This involves activating a predefined emergency response plan, which typically includes immediate patient assessment and stabilization, securing the affected area to prevent unauthorized access and further exposure, and initiating communication channels with relevant internal departments, e.g., radiation safety officers, medical physics, nursing, and external authorities as mandated by European directives on nuclear safety and radiation protection. The emphasis on a coordinated, systematic approach, guided by established protocols and expert consultation, ensures that actions are taken in accordance with best practices and regulatory requirements, minimizing risks and optimizing patient outcomes. This aligns with the principles of ALARA, as low as reasonably achievable, in emergency situations, and the duty of care owed to patients and staff under European law. Incorrect approaches analysis. One incorrect approach involves prioritizing the immediate evacuation of all non-essential personnel without first securing the immediate area or assessing the specific nature of the emergency. This could lead to the spread of contamination, increased risk of exposure to a wider group of individuals, and disruption of critical patient care. It fails to adhere to the principle of containment and controlled response mandated by radiation safety regulations. Another incorrect approach is to delay the notification of the radiation safety officer and relevant medical teams, opting instead for a more informal resolution. This bypasses the established chain of command and expert consultation crucial for managing radiation emergencies. It directly violates regulatory requirements for reporting and managing radiation incidents, potentially leading to inadequate containment, delayed medical intervention, and significant legal and ethical repercussions. A third incorrect approach might be to focus solely on external communication with regulatory bodies, without first ensuring the immediate safety and containment of the incident within the facility. While external communication is vital, it should not supersede the immediate actions required to protect individuals within the affected environment. This approach neglects the primary responsibility of the institution to manage the immediate crisis effectively. Professional reasoning. Professionals facing such a scenario should employ a structured decision-making process. First, they must remain calm and assess the immediate situation, identifying the nature and potential scope of the emergency. Second, they should immediately activate the facility's pre-established emergency response plan, which serves as their primary guide. This plan will dictate the immediate steps for patient care, containment, and notification. Third, they must communicate clearly and concisely with the designated emergency response team and relevant authorities, providing accurate information to facilitate a coordinated response. Finally, they should continuously monitor the situation, adapt their actions based on new information, and ensure all actions are documented and comply with European regulatory requirements for radiation safety and emergency management. This systematic, protocol-driven approach, informed by expert knowledge and regulatory mandates, is essential for effective crisis management in radiation oncology. Question 3. When evaluating the contouring of the prostate gland and the seminal vesicles as a clinical target volume, CTV, for a patient undergoing radical radiotherapy and considering the bladder and rectum as organs at risk, or which of the following approaches best reflects current European best practice and regulatory expectations for ensuring treatment accuracy and patient safety? Option A. Adhering strictly to the most recent consensus guidelines for prostate cancer radiotherapy contouring, supplemented by a peer review process involving at least one other radiation oncologist before treatment planning, and ensuring all OARs are contoured according to established anatomical definitions. Option B. Contouring the prostate and seminal vesicles based on a single imaging modality, e.g., CT, without considering potential anatomical variations or the benefits of multimodal imaging, and only contouring OARs that are clearly visible on the primary planning scan. Option C. Using a generic set of OAR contouring rules that are not specific to the pelvic region or prostate cancer, and proceeding with treatment planning without formal verification of the target volume delineation by another clinician. Option D. Relying primarily on the contouring practices established by the treating institution's senior radiation oncologists over the past decade, assuming these have been effective for previous patient cohorts. The correct answer is A. Adhering strictly to the most recent consensus guidelines for prostate cancer radiotherapy contouring, supplemented by a peer review process involving at least one other radiation oncologist before treatment planning, and ensuring all OARs are contoured according to established anatomical definitions. Explanation. This scenario presents a common challenge in radiation oncology: the inherent variability in anatomical interpretation and the need for standardized, yet adaptable, contouring practices. The professional challenge lies in balancing the need for precise target delineation and OAR identification to ensure optimal treatment efficacy and patient safety, while also acknowledging inter-observer variability and the evolving nature of imaging and treatment planning technologies. Adherence to established guidelines and consensus recommendations is paramount to minimize errors and ensure consistent, high-quality patient care across different institutions and practitioners. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based methodology for contouring. This involves utilizing the most current, internationally recognized guidelines, such as those from ESTRO or relevant consensus statements, as the primary reference. These guidelines are developed by expert bodies and are designed to reflect the current state of knowledge and best practices in radiation oncology. They provide detailed anatomical definitions and visual aids for both target volumes and OARs, promoting consistency and reducing inter-observer variability. Furthermore, incorporating peer review and quality assurance (QA) processes ensures that contouring is consistently applied and errors are identified and corrected, directly aligning with ethical obligations to provide safe and effective treatment. An incorrect approach that relies solely on personal experience or institutional protocols without referencing current, validated guidelines is professionally unacceptable. This can lead to significant deviations in target delineation and OAR definition, potentially resulting in underdosing of the tumor or overdosing of critical structures. Such a failure constitutes a breach of professional responsibility and may contraindicate adherence to established standards of care, potentially leading to suboptimal treatment outcomes or increased toxicity. Another incorrect approach that neglects to consider the specific imaging modality or its limitations is also professionally flawed. Different imaging techniques, e.g., CT, MRI, PET, have varying resolutions and can depict anatomical structures differently. Failing to account for these differences can lead to inaccurate contouring. This demonstrates a lack of critical appraisal of the available data and a failure to apply best practices in image interpretation, which is a fundamental aspect of radiation oncology. Finally, an approach that does not involve any form of quality assurance or peer review for contouring is ethically and professionally deficient. This lack of oversight increases the risk of significant errors going undetected, directly impacting patient safety and treatment efficacy. It fails to uphold the principle of continuous improvement and accountability inherent in medical practice. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the specific clinical scenario and the relevant tumor site. 2. Consult the most up-to-date, internationally recognized contouring guidelines and consensus statements for that specific tumor site. 3. Critically evaluate the available imaging data, considering the strengths and limitations of each modality. 4. Apply the guidelines meticulously to delineate target volumes and OARs. 5. Engage in peer review and quality assurance processes to validate the contouring. 6. Document all decisions and justifications clearly. 7. Stay abreast of evolving guidelines and technological advancements. Question 4. The monitoring system demonstrates a consistent pattern of unexpectedly high cellular survival fractions in a specific patient cohort undergoing hypofractionated radiotherapy for prostate cancer. Which of the following investigations is most crucial for understanding and addressing this radiobiological anomaly? Option A. A comprehensive review of the radiobiological parameters used in treatment planning, including dose per fraction, overall treatment time, and tumor cell radiosensitivity assumptions, alongside an assessment of treatment delivery accuracy. Option B. Immediate escalation of the dose per fraction for all patients in this cohort to overcome potential radioresistance. Option C. A shift to a conventional fractionation schedule without further investigation into the specific radiobiological underpinnings of the observed survival fractions. Option D. Dismissal of the findings as statistical outliers due to the inherent variability in biological responses. The correct answer is A. A comprehensive review of the radiobiological parameters used in treatment planning, including dose per fraction, overall treatment time, and tumor cell radiosensitivity assumptions, alongside an assessment of treatment delivery accuracy. Explanation. The monitoring system demonstrates a consistent pattern of unexpectedly high cellular survival fractions in a specific patient cohort undergoing hypofractionated radiotherapy for prostate cancer. This scenario is professionally challenging because it directly impacts patient outcomes and raises questions about the efficacy and safety of the prescribed treatment regimen. Clinicians must balance the need for effective cancer control with the imperative to minimize radiation-induced toxicity, all while adhering to established radiobiological principles and regulatory guidelines for patient care. The challenge lies in accurately interpreting the observed data, identifying potential underlying causes, and implementing appropriate corrective actions without compromising patient safety or treatment effectiveness. The correct approach, which involves a comprehensive review of the radiobiological parameters and treatment delivery, represents best professional practice. This aligns with the European Diploma in Radiation Oncology's emphasis on evidence-based practice and continuous quality improvement. Specifically, it reflects the regulatory framework's expectation that radiation oncology departments actively monitor treatment outcomes and investigate deviations from expected results. A thorough radiobiological assessment, considering factors like dose per fraction, overall treatment time, tumor cell sensitivity, alpha/beta ratio, and potential repopulation kinetics, is crucial for understanding why survival fractions might be higher than anticipated. This systematic investigation allows for informed adjustments to treatment planning or delivery, ensuring that the prescribed dose is biologically effective while remaining within acceptable toxicity limits, thereby upholding the ethical duty of beneficence and non-maleficence. An incorrect approach would be to dismiss the observed high survival fractions as statistical anomalies without further investigation. This fails to acknowledge the potential for systemic issues in treatment planning, delivery, or patient-specific radiobiological differences. Ethically, this constitutes a failure to act in the patient's best interest and a disregard for the principle of vigilance in patient care. From a regulatory standpoint, it represents a breach of quality assurance requirements that mandate the monitoring and analysis of treatment outcomes. Another incorrect approach would be to immediately escalate the dose per fraction without a thorough radiobiological evaluation. While the goal is to improve tumor control, arbitrarily increasing the dose without understanding the underlying cause of high survival fractions could lead to unacceptable toxicity, violating the principle of non-maleficence. This approach also bypasses the necessary steps of investigation and evidence gathering, mandated by good clinical practice and regulatory oversight. A further incorrect approach would be to alter the treatment schedule to a more conventional fractionation scheme, without considering the specific radiobiological characteristics of prostate cancer and the rationale for the initial hypofractionation. While a change in fractionation might be a potential solution, it should be a data-driven decision informed by a deep understanding of radiobiological principles and the specific patient cohort's response, rather than a reactive measure. This approach risks compromising the potential benefits of hypofractionation if it was indeed appropriate, and fails to address the root cause of the observed high survival fractions. The professional decision-making process for similar situations should involve a structured approach. 1. Acknowledge and document the observed deviation. 2. Initiate a multidisciplinary review involving radiation oncologists, medical physicists, and dosimetrists. 3. Conduct a detailed radiobiological analysis, considering all relevant parameters and potential influencing factors. 4. Consult relevant literature and guidelines. 5. Formulate evidence-based recommendations for corrective actions, which may include reevaluation of dose prescription, treatment planning, or delivery techniques. 6. Implement changes and continue rigorous monitoring to assess their impact. 7. Document all steps and outcomes for quality assurance and future reference. Question 5. The assessment process reveals that a radiation oncology department is using a specific dose calculation algorithm within their treatment planning system for all patient treatments, regardless of tumor site or complexity. The department head states that this algorithm has always been used and is considered the standard within their institution. A junior physicist expresses concern that for a recent complex lung SBRT case, a different algorithm might provide a more accurate dose distribution due to the presence of significant tissue heterogeneities. Which of the following approaches best reflects the professional and regulatory expectation for selecting and utilizing dose calculation algorithms in radiation oncology within the European framework? Option A. The department should immediately switch to the algorithm suggested by the junior physicist for all treatments, without further investigation, to address the perceived potential for improvement. Option B. The department should conduct a thorough evaluation of all available dose calculation algorithms within their treatment planning system, comparing their accuracy and suitability for various clinical scenarios, including complex cases like lung SBRT. The selection of an algorithm should be based on evidence-based practice, documented justification, and adherence to European guidelines for treatment planning system validation, with a clear protocol for when to deviate from the default algorithm. Option C. The department should continue using the established standard algorithm as it has been used historically, assuming it is adequate for all cases unless significant evidence of patient harm is directly attributable to its use. Option D. The junior physicist should be instructed to use the standard algorithm for all cases to maintain consistency and avoid introducing variability, and their concerns should be dismissed as they are based on theoretical rather than proven issues. The correct answer is B. The department should conduct a thorough evaluation of all available dose calculation algorithms within their treatment planning system, comparing their accuracy and suitability for various clinical scenarios, including complex cases like lung SBRT. The selection of an algorithm should be based on evidence-based practice, documented justification, and adherence to European guidelines for treatment planning system validation, with a clear protocol for when to deviate from the default algorithm. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology, where different dose calculation algorithms within treatment planning systems, TPS, can yield varying dose distributions for the same treatment plan. The professional challenge lies in ensuring that the chosen algorithm is not only technically appropriate for the specific clinical situation, but also aligns with established European guidelines and best practices for patient safety and treatment efficacy. The need for a robust justification for algorithm selection, especially when deviating from standard practice or when uncertainty exists, is paramount. This requires a deep understanding of the algorithm's underlying physics, their limitations, and their impact on clinical outcomes, all within the regulatory framework of the European Diploma in Radiation Oncology. Correct approach analysis. The correct approach involves a thorough, evidence-based evaluation of the TPS's dose calculation algorithms, considering their suitability for the specific clinical scenario, e.g., complex anatomy, presence of heterogeneities, specific beam energies. This evaluation should be documented and justified by referencing relevant scientific literature and any applicable European guidelines or recommendations for TPS validation and algorithm selection. The decision to use a particular algorithm, especially if it's not the default or most commonly used one, must be based on a clear understanding of its advantages and disadvantages in the given context, ensuring that it leads to a more accurate and clinically relevant dose distribution without compromising patient safety. This aligns with the European Diploma's emphasis on evidence-based practice and the responsible use of technology to optimize patient care. Incorrect approaches analysis. Choosing an algorithm solely based on its speed or ease of use, without a critical evaluation of its accuracy and suitability for the clinical scenario, represents a significant regulatory and ethical failure. This approach prioritizes efficiency over patient safety and treatment quality, potentially leading to under- or overdosing of critical structures or the target volume. It violates the principle of providing the best possible care, which is implicitly mandated by the European Diploma's standards. Selecting an algorithm based on anecdotal evidence or the preference of a colleague, without independent verification or a clear understanding of its limitations, is also professionally unacceptable. This practice lacks scientific rigor and can perpetuate the use of suboptimal algorithms, potentially compromising patient outcomes. It fails to adhere to the evidence-based principles expected in radiation oncology and could be seen as a breach of professional responsibility. Failing to document the rationale for algorithm selection, especially when a non-standard choice is made, creates a lack of transparency and accountability. This makes it difficult to review the treatment planning process, identify potential errors, or learn from past decisions. It undermines the quality assurance processes expected within a regulated healthcare environment and is contrary to the principles of good clinical practice. Professional reasoning. Professionals should approach TPS algorithm selection with a systematic and critical mindset. The decision-making process should involve 1. Understanding the clinical context and the specific dosimetric challenges presented by the patient's anatomy and treatment intent. 2. Familiarizing oneself with the capabilities and limitations of the available dose calculation algorithms within the TPS. 3. Consulting relevant scientific literature and European guidelines for best practices in TPS validation and algorithm selection. 4. Performing independent verification or validation of the chosen algorithm's performance for the specific clinical scenario, if necessary. 5. Documenting the rationale for the chosen algorithm, including any deviations from standard practice and the justification for those deviations. 6. Engaging in peer review and discussion to ensure the chosen approach aligns with current standards of care and promotes patient safety. Question 6. Benchmark analysis indicates that understanding the tumor microenvironment, TME, is increasingly crucial for predicting radiation response. Considering the European regulatory framework for radiation oncology, which approach best reflects the integration of TME insights into clinical practice for optimizing patient outcomes. Option A. Systematically reviewing current European guidelines and peer-reviewed literature to identify validated TME factors and evidence-based interventions that demonstrably improve radiation response, and applying these judiciously. Option B. prioritizing the use of experimental TME biomarkers for patient stratification and treatment selection, even when the predictive value and clinical utility are not yet firmly established by robust evidence. Option C. Implementing novel TME targeting agents into standard radiation protocols based on promising preclinical data and early-phase clinical trials, without waiting for definitive outcome data. Option D. Continuing with established radiation therapy protocols without considering TME modifications, as the clinical impact of TME factors on radiation response is still considered too complex and variable. The correct answer is A. Systematically reviewing current European guidelines and peer-reviewed literature to identify validated TME factors and evidence-based interventions that demonstrably improve radiation response, and applying these judiciously. Explanation. Scenario analysis. This scenario presents a professional challenge due to the evolving understanding of the tumor microenvironment, TME, and its complex influence on radiation therapy outcomes. Clinicians must integrate novel biological insights into established treatment protocols, requiring a nuanced approach that balances evidence-based practice with the potential for personalized medicine. The challenge lies in discerning which TME-related factors are sufficiently validated and clinically actionable to modify standard radiation planning and delivery, while adhering to the European Diploma in Radiation, Oncology's emphasis on evidence-based and ethically sound patient care. Correct approach analysis. The correct approach involves a thorough review of current European guidelines and peer-reviewed literature, specifically addressing the impact of identified TME components, e.g., hypoxia, immune cell infiltration, stromal composition, on radiation sensitivity and resistance. This approach prioritizes evidence that demonstrates a statistically significant and clinically meaningful correlation between TME characteristics and treatment response, as well as evidence supporting the efficacy and safety of therapeutic interventions targeting these components. It aligns with the ethical principle of beneficence by seeking to optimize patient outcomes through informed decision-making, and with the regulatory framework's requirement for practitioners to stay abreast of scientific advancements and apply them judiciously. This approach ensures that any deviation from standard practice is based on robust data and contributes to improved patient care without introducing undue risk. Incorrect approaches analysis. One incorrect approach would be to unilaterally incorporate experimental TME targeting agents into radiation protocols based on preliminary or anecdotal evidence. This fails to meet the regulatory and ethical standard of evidence-based practice. Such an approach risks exposing patients to unproven toxicities and may not improve outcomes, potentially violating the principle of non-maleficence. It bypasses the rigorous validation required by the European regulatory framework for novel therapeutic strategies. Another incorrect approach would be to dismiss the significance of the TME entirely, continuing with standard protocols without considering any TME-related modifications, even when compelling evidence suggests a benefit. This represents a failure to adapt to scientific progress and may lead to suboptimal treatment for patients whose tumors exhibit specific TME features known to confer radiation resistance. Ethically, this could be seen as a failure to provide the best possible care, and from a regulatory perspective, it might indicate a lack of engagement with evolving best practices. A third incorrect approach would be to overinterpret limited or conflicting data regarding specific TME biomarkers, leading to overly aggressive or unnecessary treatment modifications. This can result in increased toxicity without a commensurate gain in efficacy, again, potentially violating the principle of non-maleficence and failing to adhere to the cautious, evidence-driven approach mandated by the European regulatory framework. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with identifying the specific TME components relevant to the patient's tumor type and stage. This is followed by a critical appraisal of the existing scientific literature and relevant European guidelines concerning the prognostic and predictive value of these components. The next step involves evaluating the evidence for therapeutic interventions that modulate these TME factors in conjunction with radiation therapy. Decisions should be made collaboratively with the patient, ensuring informed consent based on a clear understanding of the potential benefits, risks, and uncertainties. This process ensures that clinical practice remains aligned with the highest standards of evidence-based medicine, patient safety, and ethical responsibility, as expected within the European Radiation Oncology Framework. Question 7. The risk matrix shows a moderate probability of exceeding dose limits for staff during a specific brachytherapy procedure, coupled with a severe consequence if it occurs. Which of the following approaches best embodies the ALARA principle in optimizing radiation protection for personnel involved in this procedure? Option A. Requiring all staff involved in the procedure to wear the highest available lead aprons and thyroid shields at all times, regardless of their proximity to the radiation source. Option B. Relying on routine post-procedure dose surveys of the treatment room and staff to identify any overexposures after they have occurred. Option C. Implementing a comprehensive review of the entire brachytherapy workflow, from source preparation and loading to patient positioning and post-procedure cleanup, to identify and implement engineering controls, optimize procedural steps to minimize time and distance, and ensure adequate shielding is in place at all stages. Option D. Dismissing the risk matrix findings as the procedure is performed infrequently, and assuming that the probability of exceeding dose limits is negligible in practice. Correct answer is C. Implementing a comprehensive review of the entire brachytherapy workflow, from source preparation and loading to patient positioning and post-procedure cleanup, to identify and implement engineering controls, optimize procedural steps to minimize time and distance, and ensure adequate shielding is in place at all stages. Explanation. The risk matrix shows a moderate probability of exceeding dose limits for staff during a specific brachytherapy procedure, coupled with a severe consequence if it occurs. This scenario is professionally challenging because it requires balancing the imperative of effective patient treatment with the equally critical need for radiation safety for healthcare professionals, adhering to the ALARA, as low as reasonably achievable principle. The challenge lies in identifying and implementing practical, effective, and compliant measures to reduce risk without compromising treatment quality or introducing new hazards. The correct approach represents best professional practice because it directly addresses the identified risk through a multifaceted strategy that prioritizes engineering controls, administrative procedures, and personal protective equipment, all aligned with the ALARA principle. This systematic reduction of potential exposure, from source handling to patient positioning and room design, demonstrates a proactive and comprehensive commitment to radiation safety as mandated by European radiation protection directives. It involves a thorough review and optimization of the entire workflow, seeking to minimize time, distance, and shielding where feasible and appropriate for the specific procedure. An incorrect approach that focuses solely on increasing personal shielding for staff, without re-evaluating the procedure itself, fails to address the root causes of potential exposure. This is a regulatory failure as it does not strive for the lowest reasonably achievable dose, but rather attempts to mitigate a potentially high dose after the fact, which is less effective and may not be sufficient. Ethically, it places a greater burden on staff without exploring more fundamental safety improvements. Another incorrect approach that relies solely on post-procedure dose monitoring for staff, without implementing preventative measures during the procedure, is a significant regulatory and ethical failure. This reactive stance is contrary to the ALARA principle, which mandates proactive risk reduction. It fails to protect staff during the exposure event and represents a dereliction of the duty of care owed to them. A third incorrect approach that dismisses the risk matrix findings due to the perceived infrequency of the procedure is also a critical failure. The ALARA principle and radiation protection regulations do not permit complacency based on frequency. Even rare events with severe consequences warrant rigorous safety protocols. This approach ignores the potential for severe harm and violates the spirit and letter of radiation safety legislation, which requires continuous risk assessment and mitigation. The professional decision-making process for similar situations should involve a systematic risk assessment, identifying potential exposure pathways, and estimating dose levels. This should be followed by brainstorming and evaluating a hierarchy of controls, elimination/substitution, often not feasible in patient treatment, engineering controls e.g., shielding, remote handling, administrative controls e.g., procedures, training, time limits, and finally, personal protective equipment. The chosen strategies must be demonstrably effective in reducing dose to levels that are as low as reasonably achievable, considering economic and social factors, and must be regularly reviewed and updated. Question 8. Operational review demonstrates that a radiation oncology department is experiencing variability in the effectiveness of photon beam radiotherapy for a specific tumor site, with some patients achieving excellent local control, while others experience suboptimal outcomes or increased toxicity. The review highlights a need to reevaluate the fundamental understanding of how the prescribed radiation dose is actually deposited within the heterogeneous tissues of the treatment volume. Which of the following approaches best addresses this challenge by focusing on the physical interaction of ionizing radiation with matter? Option A. An in-depth study of the radiobiological response of tumor cells and normal tissues to varying radiation doses, focusing on DNA damage and repair mechanisms. Option B. An assessment of the efficiency and speed of the linear accelerator's beam delivery system and the department's overall treatment throughput. Option C. Comprehensive reevaluation of the physical processes governing photon interaction with biological tissues, including the photoelectric effect, Compton scattering, and pair production, and how these phenomena influence energy deposition across different tissue densities and compositions. Option D. A review of historical treatment outcomes for this tumor site, correlating patient demographics with observed local control rates and toxicity profiles. The correct answer is C. A comprehensive reevaluation of the physical processes governing photon interaction with biological tissues, including the photoelectric effect, Compton scattering, and pair production, and how these phenomena influence energy deposition across different tissue densities and compositions. Explanation. Scenario analysis. This scenario presents a professional challenge in ensuring the accurate and safe application of radiation therapy, directly impacting patient outcomes and safety. The core difficulty lies in understanding and mitigating the subtle but significant effects of radiation interaction with biological tissues, which can vary based on the specific characteristics of the radiation beam and the patient's anatomy. Misinterpreting these interactions can lead to under- or overtreatment, increasing the risk of local recurrence or severe toxicity. The challenge is amplified by the need to adhere to strict European guidelines for radiation oncology practice, which emphasize evidence-based decision-making and patient safety. Correct approach analysis. The correct approach involves a thorough understanding of the physical processes governing how ionizing radiation interacts with matter at a cellular and molecular level. This includes recognizing that different types of radiation, e.g., photons, electrons, protons, and their energy spectra will deposit energy in tissue differently. For instance, understanding concepts like the photoelectric effect, Compton scattering, and pair production for photons, or the Bragg peak phenomenon for charged particles, is crucial for predicting dose distribution and biological effect. This knowledge directly informs treatment planning, dose prescription, and the selection of appropriate radiation modalities, aligning with the European Society for Radiotherapy and Oncology, ESTRO, guidelines that advocate for a physics-informed approach to optimize therapeutic ratios. Adherence to these principles ensures that the delivered dose is precisely targeted to the tumor while minimizing damage to surrounding healthy tissues, thereby upholding the ethical imperative of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach would be to rely solely on empirical observations or historical treatment protocols without a deep understanding of the underlying physics of radiation-matter interaction. This fails to account for variations in patient anatomy, tumor characteristics, or advancements in radiation delivery techniques, potentially leading to suboptimal dose delivery and increased toxicity. It represents a failure to engage with the scientific basis of radiation oncology, contravening the European framework's emphasis on evidence-based practice and continuous professional development. Another incorrect approach would be to prioritize treatment speed or ease of delivery over a precise understanding of radiation deposition. This might involve using simplified models or assumptions about dose distribution that do not accurately reflect the complex interactions of radiation with biological tissues. Such an approach neglects the fundamental principles of radiation physics and dosimetry, potentially leading to significant under- or overdosing, which is a direct violation of patient safety standards mandated by European regulations and ethical guidelines. A further incorrect approach would be to focus exclusively on the biological effects of radiation, without considering the physical mechanisms by which those effects are produced. While understanding radiobiology is essential, it must be integrated with a robust understanding of radiation physics. Without this integration, treatment decisions may not accurately reflect the intended dose distribution or the potential for differential biological responses within the treatment volume, leading to unintended consequences and a failure to optimize the therapeutic outcome as expected by European standards of care. Professional reasoning. Professionals facing such scenarios should adopt a systematic approach. First, identify the specific radiation modality and energy being used. Second, recall and apply the fundamental principles of radiation-matter interaction relevant to that modality. Third, consider how these interactions influence dose deposition within the patient's specific anatomy. Fourth, integrate this physical understanding with radiobiological principles to predict the biological effect. Finally, use this comprehensive understanding to inform treatment planning, dose prescription, and quality assurance, ensuring compliance with European regulatory frameworks and ethical obligations to the patient. This iterative process of physical and biological assessment is key to optimizing treatment and minimizing harm. Question 9. The assessment process reveals a need to improve the efficiency and accuracy of the radiation oncology treatment pathway. Which of the following strategies best aligns with the principles of process optimization in this context? Option A. Focusing solely on acquiring the latest imaging equipment without evaluating how it integrates into existing workflows or impacts patient throughput. Option B. Implementing a comprehensive review of all treatment planning parameters and delivery protocols, utilizing data analytics to identify and address systemic inefficiencies and potential sources of error. Option C. Increasing the number of treatment slots available per day by extending clinic hours and reducing the time allocated for each patient consultation. Option D. Encouraging individual clinicians to independently refine their personal treatment planning techniques without a coordinated departmental effort. The correct answer is B. Implementing a comprehensive review of all treatment planning parameters and delivery protocols, utilizing data analytics to identify and address systemic inefficiencies and potential sources of error. Explanation. The assessment process reveals a critical need to optimize radiation oncology workflows to enhance patient safety and treatment efficacy. This scenario is professionally challenging because it requires balancing the imperative for timely patient care with the meticulous adherence to established protocols and the continuous pursuit of improved outcomes. Professionals must navigate complex interdependencies between different stages of the treatment pathway, from initial diagnosis and treatment planning to delivery and follow-up. The European Diploma in Radiation Oncology framework emphasizes a patient-centered approach, underpinned by robust quality assurance and a commitment to evidence-based practice. The correct approach represents best professional practice because it prioritizes a systematic, data-driven evaluation of the entire treatment pathway. This involves identifying bottlenecks, inefficiencies, and potential points of error through objective analysis. By focusing on process optimization, professionals can implement targeted improvements that enhance throughput, reduce waiting times, minimize inter-observer variability, and ultimately improve the quality of care delivered. This aligns with the European Society for Radiotherapy and Oncology, ESTRO, guidelines and the principles of good clinical practice, which advocate for continuous quality improvement and the adoption of best available technologies and methodologies. Regulatory frameworks within the European Union, such as those pertaining to medical devices and patient safety, implicitly support such optimization efforts by demanding high standards of care and accountability. An incorrect approach that focuses solely on increasing the number of patients treated without a corresponding assessment of workflow efficiency would be professionally unacceptable. This could lead to rushed decision-making, increased risk of errors in treatment planning or delivery, and a decline in the overall quality of care, potentially violating ethical obligations to provide safe and effective treatment. Another incorrect approach that neglects the integration of new technologies or methodologies, despite evidence of their benefit, would fail to uphold the principle of providing the best possible care and could be seen as a failure to keep pace with advancements in the field, potentially contravening professional development expectations. A third incorrect approach that prioritizes individual departmental goals over the holistic patient journey would create fragmentation in care, leading to delays and suboptimal outcomes, which is contrary to the collaborative and integrated nature of modern radiation oncology. Professional decision-making in such situations requires a structured approach. This involves clearly defining the problem, gathering relevant data, analyzing the current process, identifying areas for improvement, developing and implementing solutions, and finally, evaluating the impact of those changes. This iterative process ensures that optimizations are evidence-based, safe, and contribute to the overall enhancement of patient care, adhering to the highest professional and ethical standards expected within the European radiation oncology community. Question 10. Compliance review shows a minor discrepancy between the planned radiation dose for a patient and the recorded delivered dose, as indicated by the treatment planning system and the machine log. The difference is within what is generally considered a small tolerance for daily variations, but it is not precisely accounted for by known factors such as patient setup adjustments. Option A. Discuss the discrepancy informally with a colleague to gauge their opinion on whether it warrants formal reporting, and proceed based on their advice. Option B. Assume the discrepancy is within acceptable limits for routine variation and make a note in the patient's chart to review it at the next scheduled audit. Option C. Manually adjust the recorded delivered dose in the patient's record to match the planned dose, as the difference is minimal and unlikely to impact treatment outcome. Option D. Immediately report the discrepancy to the radiation safety officer and initiate an investigation into its cause, documenting all findings and actions taken. The correct answer is D. Immediately report the discrepancy to the radiation safety officer and initiate an investigation into its cause, documenting all findings and actions taken. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the potential for subtle, yet significant, deviations from established dosimetry and monitoring protocols. The core difficulty lies in balancing the immediate need for efficient patient care with the long-term imperative of maintaining accurate and reliable radiation exposure records for both patients and staff. The ethical dilemma arises from the potential for overlooking minor discrepancies that, if unaddressed, could compromise the integrity of radiation safety practices and regulatory compliance. Careful judgment is required to discern between acceptable minor variations and those that necessitate immediate corrective action. Correct approach analysis. The correct approach, which involves immediate reporting and investigation of the discrepancy, represents best professional practice because it upholds the fundamental principles of radiation safety and regulatory compliance. European guidelines and national regulations governing radiation oncology mandate meticulous record-keeping of radiation doses delivered to patients and occupational exposure of staff. Prompt reporting ensures that any potential under- or over-delivery of radiation is identified and rectified, safeguarding patient well-being and preventing cumulative errors. Furthermore, it demonstrates adherence to the principle of ALARA, as low as reasonably achievable for staff exposure, and ensures that patient treatment plans are delivered as prescribed, which is a cornerstone of quality patient care and a regulatory requirement. This proactive stance also supports the continuous improvement of radiation therapy services by identifying systemic issues that may require protocol adjustments or additional training. Incorrect approaches analysis. One incorrect approach involves dismissing the discrepancy as a minor, inconsequential deviation due to the perceived minimal difference in dose. This fails to acknowledge that even small deviations can accumulate over a course of treatment, potentially leading to suboptimal clinical outcomes or exceeding acceptable dose limits. Ethically, it breaches the duty of care to the patient, and professionally, it violates the regulatory requirement for accurate dosimetry and record-keeping. It also undermines the principle of ALARA for staff if the discrepancy relates to monitoring equipment calibration or operational procedures. Another incorrect approach is to attempt to manually adjust the patient's record to match the expected dose without a formal investigation or justification. This constitutes falsification of records, a severe ethical and regulatory violation. It masks the underlying issue, preventing its correction and potentially leading to future, more significant errors. This action directly contravenes the principles of transparency and accountability essential in healthcare and radiation safety. A third incorrect approach is to delay reporting the discrepancy until the next scheduled audit. This delay introduces a window of uncertainty regarding the actual dose delivered and received. It compromises the ability to conduct a timely and effective investigation, potentially hindering the identification of the root cause and the implementation of corrective actions. This delay can also have implications for patient management if the discrepancy is significant enough to warrant immediate clinical review, and it fails to meet the spirit of prompt reporting expected by regulatory bodies. Professional reasoning. Professionals facing such a situation should employ a decision-making framework that prioritizes patient safety, regulatory compliance, and ethical conduct. This framework involves 1. Immediate identification and documentation of the discrepancy. 2. Prompt and transparent reporting to the appropriate radiation safety officer or responsible authority. 3. Participation in a thorough investigation to determine the root cause. 4. Implementation of corrective actions based on the investigation's findings. 5. Verification that corrective actions have been effective. This systematic approach ensures that all deviations are addressed rigorously, maintaining the highest standards of radiation oncology practice. Question 11. The control framework reveals a situation where a patient requires urgent radiotherapy for a life-threatening condition, but the planned treatment delivery method, due to the specific tumor location and required dose, presents a higher than usual risk of scatter radiation to adjacent areas within the treatment facility, potentially impacting other patients and staff if not meticulously managed. The radiation oncologist is aware of the increased risk, but also of the critical time sensitivity for the patient's treatment. What is the most appropriate course of action for the radiation oncologist? Option A. Proceed with the treatment immediately as the patient's condition is critical and address any potential radiation safety concerns retrospectively. Option B. Administer a lower, less effective dose of radiation to minimize scatter, accepting a compromise in treatment efficacy to avoid potential safety issues. Option C. Delay the treatment until a comprehensive, facility-wide review of all radiation safety protocols can be completed, even if this significantly impacts the patient's treatment timeline. Option D. Consult with the facility's radiation protection expert to assess the specific risks and collaboratively develop and implement enhanced shielding and monitoring measures before commencing treatment. Correct answer is A. Proceed with the treatment immediately as the patient's condition is critical and address any potential radiation safety concerns retrospectively. Explanation. This scenario presents a professional challenge rooted in the inherent tension between patient care and radiation safety regulations. The physician faces a situation where a patient's urgent need for treatment might conflict with established protocols for radiation protection, particularly concerning the potential for unintended exposure to other individuals. Careful judgment is required to balance these competing ethical and regulatory imperatives. The correct approach prioritizes patient safety and adherence to the European Diploma in Radiation Oncology's regulatory framework, which emphasizes minimizing radiation exposure to all individuals, including staff and the public. This involves a thorough risk assessment and the implementation of appropriate shielding and containment measures. By consulting with the radiation protection expert and ensuring all safety protocols are met before proceeding, the physician upholds the highest standards of professional practice, demonstrating a commitment to both effective treatment and responsible radiation management as mandated by European guidelines. An incorrect approach that proceeds with treatment without adequate consultation or safety measures would represent a significant regulatory and ethical failure. This could lead to breaches of radiation safety legislation, potentially exposing individuals to unnecessary radiation and resulting in legal repercussions and damage to professional reputation. Another incorrect approach, such as delaying treatment indefinitely due to minor perceived risks without exploring mitigation strategies, would fail to meet the ethical obligation to provide timely and necessary medical care, potentially harming the patient's prognosis. Professional decision-making in such situations requires a systematic approach. First, identify the core ethical and regulatory conflict. Second, consult relevant guidelines and experts, in this case the radiation protection expert. Third, conduct a comprehensive risk assessment, considering all potential exposures. Fourth, explore all feasible mitigation strategies to minimize risks. Finally, make a decision that demonstrably prioritizes patient well-being, while strictly adhering to regulatory requirements for radiation safety. Question 12. Strategic planning requires a nuanced understanding of the different types of radiation used in oncology, considering the distinct physical properties and biological interactions of alpha, beta, gamma, and X-rays. Which of the following best informs the development of effective and safe radiation therapy protocols within the European regulatory framework? Option A. Focusing primarily on the historical discovery and initial applications of alpha, beta, gamma, and X-rays in medicine, as this provides context for their current use. Option B, prioritizing the relative biological effectiveness, RBE, and linear energy transfer, lead of each radiation type, alongside their penetration depth and energy deposition characteristics to guide treatment planning and safety measures. Option C, emphasizing the penetration depth of each radiation type as the sole determinant for selecting appropriate shielding and treatment planning strategies. Option D, treating gamma and X-rays as functionally identical for all clinical purposes due to their similar electromagnetic nature, simplifying treatment planning. The correct answer is B, prioritizing the relative biological effectiveness, RBE, and linear energy transfer, LET, of each radiation type, alongside their penetration depth and energy deposition characteristics to guide treatment planning and safety measures. Explanation: this scenario is professionally challenging because it requires a radiation oncologist to critically evaluate the fundamental properties of different radiation types in the context of their clinical application and potential impact on patient care and safety, adhering strictly to European guidelines for radiation oncology. The challenge lies in discerning the most appropriate understanding of these radiation types for strategic planning, which underpins treatment protocols and safety measures. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of the physical characteristics and biological interactions of alpha, beta, gamma, and X-rays, which is essential for effective and safe radiation oncology. This understanding directly informs treatment planning, dose calculation, shielding requirements, and patient management. Aligning with the European Diploma in Radiation, oncology's emphasis on foundational knowledge and its application. It ensures that strategic decisions are based on accurate scientific principles, leading to optimized therapeutic outcomes and minimized risks. An incorrect approach that focuses solely on the penetration depth of radiation, without considering its ionizing potential or biological effectiveness, would be a regulatory and ethical failure. This is because it oversimplifies the complex interactions of radiation with biological tissues, potentially leading to suboptimal treatment planning or inadequate safety precautions. For instance, prioritizing only penetration depth might overlook the high linear energy transfer, LET, and biological damage potential of alpha particles, which, despite their short range, can cause significant localized damage if internalized. Similarly, an approach that neglects the distinct physical properties of gamma and X-rays, treating them as interchangeable, would be a failure to adhere to the precise scientific understanding required by the European framework, potentially impacting dose calculations and shielding strategies. Another incorrect approach might be to focus on the historical discovery of these radiation types rather than their current clinical relevance and physical characteristics, which would be a failure to apply relevant knowledge to contemporary practice. Professionals should employ a decision-making framework that begins with a thorough review of the fundamental physics and radiobiology of each radiation type. This should be followed by an assessment of how these properties translate into clinical utility and safety considerations within the European regulatory context. Strategic planning should then integrate this knowledge to inform treatment selection, dose prescription, delivery techniques, and radiation protection measures, ensuring that decisions are evidence-based and compliant with established European standards for radiation oncology. Question 13. Market research demonstrates that a significant proportion of radiation oncologists are increasingly interested in exploring novel applications of radiation physics principles to personalized treatment. A radiation oncologist observes a subtle, yet theoretically plausible, deviation in the expected dose distribution in a specific patient cohort due to a unique combination of anatomical factors and beam arrangements. This deviation, while not currently addressed by standard protocols, suggests a potential for either improved tumor coverage or reduced dose to organs at risk, depending on the precise interpretation of the underlying physics. The oncologist is faced with deciding how to proceed with this observation. Option A. Consult with a qualified medical physicist to thoroughly investigate the theoretical physics behind the observed deviation, assess its potential clinical impact, and explore the feasibility of a controlled investigation or modification of treatment planning parameters. Option B. Disregard the observation as a minor anomaly, attributing it to measurement error or statistical fluctuation, and continue with standard treatment protocols without further investigation. Option C. Discuss the theoretical observation with the affected patients, presenting it as a potential but unproven method to improve their treatment outcomes, without prior validation or expert consensus. Option D. Immediately adjust the treatment plan for all patients in this cohort to incorporate the theoretical understanding of the observed deviation, aiming to optimize dose distribution based on the initial hypothesis. The correct answer is A. Consult with a qualified medical physicist to thoroughly investigate the theoretical physics behind the observed deviation, assess its potential clinical impact, and explore the feasibility of a controlled investigation or modification of treatment planning parameters. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from the inherent uncertainty in applying theoretical radiation physics principles to individual patient treatment. The physician must balance the established scientific understanding of radiation interactions with the potential for unforeseen biological responses and the need for patient-specific optimization. The ethical dilemma arises from the potential for a novel approach to improve outcomes versus the risk of deviating from standard, evidence-based practice without sufficient justification, potentially compromising patient safety or efficacy. Correct approach analysis. The correct approach, which involves consulting with a qualified medical physicist to explore the theoretical underpinnings and potential clinical implications of the observed phenomenon, represents best professional practice. This aligns with the European Diploma in Radiation Oncology's emphasis on a rigorous, evidence-based, and multidisciplinary approach to patient care. It respects the principle of beneficence by seeking to understand and potentially leverage new knowledge for patient benefit, while upholding non-maleficence by ensuring any proposed changes are thoroughly vetted by experts in radiation physics and dosimetry. This approach is ethically sound as it prioritizes patient safety and optimal treatment through collaboration and adherence to established scientific and clinical protocols. Incorrect approach is analysis. One incorrect approach involves immediately implementing a modified treatment plan based solely on the theoretical observation, without further investigation or consultation. This is ethically unacceptable as it bypasses essential steps of validation and expert review, potentially leading to unintended consequences such as underdosing or overdosing critical structures, or introducing new, uncharacterized risks. It violates the principle of non-maleficence and demonstrates a failure to adhere to the rigorous standards expected in radiation oncology. Another incorrect approach is to dismiss the observation entirely due to its theoretical nature and lack of immediate clinical precedent. This is professionally suboptimal as it may stifle innovation and prevent the discovery of improved treatment strategies. While caution is necessary, outright dismissal without exploration can be seen as a failure of due diligence and a missed opportunity to advance patient care, potentially contravening the spirit of continuous improvement inherent in medical practice. A further incorrect approach is to discuss the theoretical observation with the patient directly, framing it as a potential breakthrough without the necessary scientific validation or expert consensus. This is ethically problematic as it may create unrealistic expectations, cause undue anxiety, and undermine the patient's trust in established treatment protocols. It also represents a premature communication of unverified information, which is contrary to the principles of informed consent and transparent patient communication. Professional reasoning. Professionals facing such situations should employ a systematic decision-making process. This involves 1. Acknowledging and documenting the observation. 2. Consulting with relevant experts, e.g., medical physicists, senior clinicians, to thoroughly investigate the theoretical basis and potential implications. 3. Reviewing existing literature and evidence for similar phenomena. 4. If promising, designing a structured research protocol or pilot study to evaluate the approach rigorously. 5. Communicating findings transparently with patients and the multidisciplinary team throughout the process. This framework ensures that patient care remains paramount, grounded in scientific integrity and ethical considerations. Question 14. Stakeholder feedback indicates a growing interest among radiation oncologists in adopting a novel stereotactic radiotherapy technique for a specific oncological indication, based on promising early-stage research presented at a recent international conference. However, this technique has not yet been incorporated into any major European clinical guidelines, and formal ethical approval for its widespread use in routine clinical practice has not been obtained. What is the most appropriate course of action for a radiation oncology department considering the implementation of this technique? Option A. Initiate a pilot study under strict ethical oversight and seek formal ethical approval before considering broader adoption, while continuing to adhere to current ESTRO guidelines for routine patient care. Option B. Immediately adopt the new technique for all eligible patients, as the preliminary research suggests significant potential benefits and patient demand is high. Option C. Begin using the technique on a case-by-case basis for patients who express strong interest, without formal ethical review, to gather personal experience. Option D. Proceed with implementing the technique based on the consensus of the department's senior clinicians, assuming it represents an advancement over current standard of care. The correct answer is A. Initiate a pilot study under strict ethical oversight and seek formal ethical approval before considering broader adoption, while continuing to adhere to current ESTRO guidelines for routine patient care. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology, balancing the desire to offer potentially beneficial novel treatments with the imperative to adhere to established evidence-based guidelines and ensure patient safety. The introduction of a new technique, even with promising preliminary data, requires rigorous evaluation before widespread adoption. The professional challenge lies in discerning when to innovate responsibly versus when to maintain adherence to current best practices, considering the potential risks and benefits for individual patients and the broader patient population. This requires a deep understanding of the evidence base, regulatory expectations, and ethical considerations. Correct approach analysis. The correct approach involves a systematic and evidence-based evaluation process. This aligns with the core principles of good clinical practice and regulatory oversight in radiation oncology. Specifically, it necessitates consulting established European Society for Radiotherapy and Oncology (ESTRO) guidelines, which represent the consensus of expert opinion and are informed by the latest scientific evidence. Furthermore, seeking ethical approval from the relevant Institutional Review Board (IRB) or Ethics Committee is a mandatory step for any deviation from standard care or the implementation of novel techniques, ensuring patient welfare and data integrity are paramount. This approach prioritizes patient safety, scientific rigor, and regulatory compliance, reflecting the highest standards of professional conduct. Incorrect approaches analysis. Implementing a novel technique based solely on anecdotal experience or preliminary, non-peer-reviewed data without formal ethical approval or consultation with established guidelines represents a significant regulatory and ethical failure. This bypasses critical safety checks and balances designed to protect patients. Relying exclusively on the enthusiasm of a research group without independent validation or adherence to established protocols can lead to suboptimal patient outcomes or unforeseen harm. Furthermore, disregarding ESTRO guidelines, which are developed through extensive peer review and consensus, indicates a failure to uphold evidence-based medicine and a potential deviation from accepted European standards of care. Professional reasoning. Professionals should adopt a decision-making framework that prioritizes patient safety, evidence-based practice, and regulatory compliance. This involves 1. Consulting relevant, up-to-date clinical guidelines e.g., ESTRO. 2. Thoroughly reviewing peer-reviewed scientific literature to assess the evidence for any proposed new technique. 3. Engaging in discussions with multidisciplinary teams and senior colleagues. 4. Seeking formal ethical approval from the appropriate Institutional Review Board or Ethics Committee before implementing any significant deviation from standard practice or introducing novel techniques. 5. Considering the potential risks, benefits, and uncertainties associated with the new approach in the context of the individual patient's clinical situation. Question 15. The efficiency study reveals that the department's brachytherapy program is experiencing increased patient wait times for certain procedures. Considering the established European guidelines for brachytherapy and the distinct radiobiological and logistical characteristics of low-dose rate (LDR) and high-dose rate (HDR) brachytherapy, which of the following strategic adjustments would best address the efficiency concerns while maintaining optimal patient care and adhering to regulatory standards? Option A. Transitioning entirely to LDR brachytherapy for all applicable tumor sites, as it requires less specialized equipment and potentially lower initial capital investment. thereby increasing the overall number of patients that can be treated with an existing infrastructure. Option B, implementing a protocol to preferentially utilize HDR brachytherapy for all eligible cases where LDR is also an option, based on its shorter treatment delivery time per fraction, to reduce overall patient throughput time. Option C, conducting a comprehensive review of patient selection criteria and treatment planning workflows for both LDR and HDR brachytherapy, evaluating the specific clinical indications where each modality offers superior dosimetric advantages and patient outcomes, and optimizing resource allocation accordingly. Option D, increasing the number of brachytherapy sessions scheduled per day without a corresponding review of staffing levels or equipment maintenance schedules, assuming that simply extending operational hours will resolve the efficiency bottleneck. The correct answer is B, implementing a protocol to preferentially utilize HDR brachytherapy for all eligible cases where LDR is also an option, based on its shorter treatment delivery time per fraction, to reduce overall patient throughput time. Explanation: this scenario presents a professional challenge in optimizing radiation oncology treatment delivery while adhering to established European guidelines and best practices for brachytherapy. The core difficulty lies in balancing the potential benefits of different brachytherapy techniques, LDR vs. HDR, with resource allocation, patient outcomes, and the need for continuous quality improvement, as mandated by regulatory frameworks governing radiation oncology in Europe. The choice between LDR and HDR brachytherapy is not merely a technical decision, but one that impacts treatment planning, delivery, patient comfort, and potentially long-term efficacy, requiring a nuanced understanding of their respective roles and limitations within the European context. The correct approach represents best professional practice because it prioritizes evidence-based decision-making and a holistic evaluation of treatment modalities. By considering factors such as dose conformity, treatment duration, patient tolerance, and the specific clinical indication, it aligns with the European Society for Radiotherapy and Oncology (ESTRO) guidelines and national regulatory requirements that emphasize patient-centered care and optimal resource utilization. This approach ensures that the chosen brachytherapy technique is the most appropriate for achieving desired clinical outcomes while minimizing potential side effects, reflecting a commitment to high-quality patient care and adherence to professional standards. An incorrect approach that focuses solely on the perceived cost-effectiveness of one modality over another, without a thorough clinical and dosimetric evaluation, would represent a significant regulatory and ethical failure. It risks compromising patient outcomes by selecting a less effective or less suitable treatment simply due to perceived financial advantages, violating the principle of beneficence and potentially contravening guidelines that mandate treatment selection based on clinical efficacy. Another incorrect approach that neglects to consider the specific radiobiological advantages of HDR for certain tumor types or the potential for improved dose escalation without increased toxicity would also be professionally unacceptable. This would fail to leverage advancements in radiation oncology and could lead to suboptimal treatment, potentially violating the principle of non-maleficence by not providing the best available care. Furthermore, an approach that disregards the need for specialized training and infrastructure for HDR brachytherapy, or fails to implement appropriate quality assurance protocols for either LDR or HDR, would be a direct violation of safety regulations and ethical obligations to ensure competent and safe practice. The professional decision-making process for similar situations should involve a multidisciplinary team review, including radiation oncologists, medical physicists, and radiation therapists. This team should critically assess the available evidence for both LDR and HDR brachytherapy in the context of the specific clinical scenario, considering patient factors, tumor characteristics, and available technology. A thorough review of relevant European guidelines and national regulations is paramount. The decision should be documented, justifying the chosen modality based on its ability to optimize therapeutic benefit and minimize harm, in line with ethical principles and regulatory requirements. Question 16. The performance metrics show a significant increase in the utilization of stereotactic body radiation therapy, SBRT, for early-stage non-small cell lung cancer, NSCLC, across several European centers. Considering the European regulatory framework and the principles of the European Diploma in Radiation Oncology, Which of the following approaches best reflects responsible clinical decision-making and quality assurance? Option A. Implement a standardized protocol for SBRT and early-stage NSCLC, ensuring all patients meet established eligibility criteria and that rigorous quality assurance checks are in place for treatment planning and delivery, with a focus on adherence to current ESTRO guidelines. Option B. Prioritize the adoption of novel SBRT delivery techniques for early-stage NSCLC to remain at the forefront of innovation, with less emphasis on strict adherence to existing guidelines if they are perceived as restrictive. Option C. Expand SBRT for early-stage NSCLC to include patients with less defined tumor margins and those with significant comorbidities, assuming that technological advancements will mitigate potential increases in toxicity. Option D. Aggressively promote the use of SBRT for early-stage NSCLC to improve patient throughput and reduce treatment times, with a secondary focus on quality assurance only if significant adverse events are reported. The correct answer is A. Implement a standardized protocol for SBRT in early-stage NSCLC, ensuring all patients meet established eligibility criteria and that rigorous quality assurance checks are in place for treatment planning and delivery, with a focus on adherence to current ESTRO guidelines. Explanation: this scenario is professionally challenging because it requires balancing the established efficacy of SBRT for specific indications with the potential for increased toxicity and the need for rigorous quality assurance, all within the European regulatory framework for radiation oncology. The decision-making process must prioritize patient safety and adherence to evidence-based guidelines, while also considering the evolving nature of SBRT techniques and their application. The correct approach represents best professional practice by prioritizing a multidisciplinary review and adherence to established European Society for Radiotherapy and Oncology (ESTRO) guidelines for SBRT. This aligns with the European Diploma in Radiation Oncology's emphasis on evidence-based practice and quality assurance. ESTRO guidelines provide a robust framework for patient selection, treatment planning, delivery, and follow-up, ensuring that SBRT is applied appropriately and safely, thereby minimizing risks and maximizing therapeutic benefit. This approach also implicitly supports the continuous professional development and knowledge sharing crucial for maintaining high standards in radiation oncology across Europe. An incorrect approach that focuses solely on increasing SBRT utilization without a corresponding increase in quality assurance measures or adherence to established guidelines would represent a significant regulatory and ethical failure. This could lead to an increased incidence of treatment-related toxicities, compromising patient safety and potentially violating principles of good clinical practice and patient-centered care. Furthermore, deviating from established European guidelines without strong, evidence-based justification could be seen as a failure to uphold professional standards and could have implications for professional accreditation and patient trust. Another incorrect approach that prioritizes cost-effectiveness over patient selection criteria or treatment quality would be ethically unacceptable, as it subordinates patient well-being to financial considerations, a clear violation of medical ethics and regulatory expectations for patient care. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's clinical presentation and the specific indication for SBRT. This should be followed by a critical review of the latest evidence and relevant European guidelines, e.g., ESTRO recommendations. A multidisciplinary team discussion involving radiation oncologists, medical physicists, and radiation therapists is essential to assess the suitability of SBRT, potential risks and benefits, and the availability of appropriate technical infrastructure and expertise. Finally, a commitment to ongoing quality assurance, outcome monitoring, and continuous professional development is paramount to ensure the safe and effective application of SBRT. Question 17. Assessment of a patient with a rapidly proliferating tumor reveals that the majority of tumor cells are in the S phase of the cell cycle. Given that cells in the S phase are generally considered to be relatively radioresistant compared to cells in the G2/M or G1 phases, which of the following therapeutic strategies would best leverage this radiobiological understanding to potentially improve tumor control? Option A. Adjusting the treatment schedule to deliver radiation when tumor cells are more likely to be in radiosensitive phases of the cell cycle, potentially through hyperfractionation or altered overall treatment time. Option B, administering a hypofractionated treatment schedule to deliver a higher dose per fraction, aiming to overcome the radioresistance of S-phase cells. Option C, increasing the total radiation dose significantly without altering the fractionation, assuming that a higher cumulative dose will overcome any cell cycle-related radioresistance. Option D, maintaining the standard fractionation schedule, as cell cycle effects are considered too complex to reliably influence clinical outcomes in routine practice. The correct answer is B, administering a hypofractionated treatment schedule to deliver a higher dose per fraction, aiming to overcome the radioresistance of S-phase cells. Explanation: this scenario presents a professional challenge in applying fundamental radiobiology principles to optimize radiation therapy, specifically considering the cell cycle dependency of radiation sensitivity. The challenge lies in accurately assessing and leveraging this knowledge within the constraints of established treatment protocols and the need for individualized patient care. Careful judgment is required to balance theoretical radiobiological understanding with practical clinical decision-making, ensuring that treatment is both effective and safe. The correct approach represents best professional practice because it directly addresses the radiobiological principle of cell cycle-dependent radiosensitivity by tailoring treatment fractionation. This aligns with the overarching goal of radiation oncology, which is to maximize tumor cell kill while minimizing damage to normal tissues. By considering the phase of the cell cycle and its impact on radiosensitivity, the clinician can potentially enhance the efficacy of radiation therapy. This approach is ethically sound as it prioritizes patient well-being and optimal treatment outcomes, adhering to principles of beneficence and non-maleficence. Regulatory frameworks in radiation oncology, while not dictating specific cell cycle targeting, implicitly support the use of evidence-based radiobiological principles to improve treatment. An incorrect approach that ignores cell cycle effects would fail to capitalize on potential therapeutic gains, potentially leading to suboptimal tumor control. This could be considered a failure in applying best available scientific knowledge, which is an ethical expectation in professional practice. Another incorrect approach that overemphasizes cell cycle targeting without sufficient clinical validation or consideration of normal tissue effects could lead to unintended toxicity, violating the principle of non-maleficence. Furthermore, deviating significantly from established protocols without a strong scientific rationale and appropriate justification could raise regulatory concerns regarding adherence to quality standards and evidence-based practice. The professional decision-making process for similar situations should involve a thorough review of the patient's specific tumor characteristics, including known cell cycle kinetics if available. This should be coupled with an understanding of the radiobiological implications of different cell cycle phases on radiation sensitivity. The clinician must then weigh this against established treatment guidelines and the potential impact on normal tissues. Consultation with radiobiologists and experienced colleagues can provide valuable insights. The decision should be evidence-based, patient-centered, and documented thoroughly, reflecting a considered application of scientific principles to achieve the best possible clinical outcome. Question 18. Comparative studies suggest that in the event of a suspected critical failure of a linear accelerator leading to potential uncontrolled radiation leakage during patient treatment, which immediate procedural response best aligns with the European Union's regulatory framework for radiation protection and emergency preparedness in medical facilities. Option A. Immediately evacuate all personnel and patients from the treatment room and adjacent areas, activate the facility's emergency response plan, and contact the designated Radiation Protection Officer, RPO, for immediate assessment and guidance. Option B. Seal the treatment room door and instruct all personnel to remain in their current locations until further instructions are received from facility management. Option C. Continue the treatment session at a reduced dose rate to minimize potential exposure while waiting for a technician to arrive. Option D. Attempt to manually override the machine's safety interlocks to assess the extent of the leakage while instructing the patient to remain still. The correct answer is A. Immediately evacuate all personnel and patients from the treatment room and adjacent areas, activate the facility's emergency response plan, and contact the designated Radiation Protection Officer, RPO, for immediate assessment and guidance. Explanation. The scenario presents a critical emergency situation in a radiation oncology department, demanding immediate and effective action to protect patients and staff from potential radiation exposure. The professional challenge lies in the rapid assessment of the situation, accurate identification of the source and extent of the emergency, and the implementation of appropriate safety protocols under pressure. This requires a deep understanding of radiation safety principles, emergency response plans, and the specific regulatory framework governing radiation oncology practice within the European Union, as mandated by the European Diploma in Radiation Oncology. The correct approach prioritizes immediate patient safety and containment of the radiation hazard, aligning with the fundamental principles of radiation protection, ALARA, as low as reasonably achievable, and the legal obligations under EU directives concerning radiation safety and emergency preparedness. This approach ensures that the response is systematic, minimizes potential harm, and adheres to established protocols for radiological incidents. It reflects best professional practice by placing paramount importance on preventing further exposure and ensuring the well-being of all individuals involved. An incorrect approach that fails to immediately secure the area and assess the extent of the contamination would represent a significant regulatory and ethical failure. It would violate the duty of care owed to patients and staff, contravening the principles of radiation protection and potentially leading to severe health consequences. Such an approach would also likely breach specific articles within EU directives related to emergency preparedness and response in facilities handling radioactive sources, such as Council Directive 2013/59/EURATOM, laying down basic safety standards for the protection of the health of workers and of the general public against the dangers arising from ionizing radiation. Failure to follow established emergency procedures and to involve the designated Radiation Protection Officer, RPO, would also constitute a breach of professional responsibility and regulatory compliance. The professional decision-making process in such a situation should involve a structured approach. First, immediate recognition and declaration of the emergency. Second, activation of the predefined emergency plan. Third, securing the affected area to prevent unauthorized access and further spread of contamination. Fourth, assessment of the situation by trained personnel, including the RPO. Fifth, implementation of appropriate decontamination and patient management strategies. And finally, thorough documentation and post-incident review. This systematic process ensures that all critical steps are taken in a timely and effective manner, guided by regulatory requirements and ethical imperatives. Question 19. Process analysis reveals a potential for enhanced precision in delivering external beam radiation therapy, EBIT, through the adoption of a novel beam-shaping technology. Considering the European regulatory framework for radiation oncology, which of the following represents the most appropriate and ethically sound approach for integrating this new technology into clinical practice? Option A. Implement the new beam-shaping technology on a limited basis for a select group of patients, without formal validation or comprehensive risk assessment, to gain initial experience. Option B. Immediately adopt the new beam-shaping technology across all relevant treatment sites, prioritizing its perceived cost-effectiveness and potential for increased patient throughput. Option C. Proceed with the adoption of the new beam-shaping technology based on manufacturer claims and preliminary in vitro data, bypassing formal peer review and regulatory consultation. Option D. Initiate a comprehensive clinical validation study, including prospective data collection and analysis, alongside a thorough risk assessment and quality assurance protocol development before widespread implementation. The correct answer is D. Initiate a comprehensive clinical validation study, including prospective data collection and analysis, alongside a thorough risk assessment and quality assurance protocol development before widespread implementation. Explanation. This scenario presents a professional challenge due to the inherent complexity of ensuring patient safety and treatment efficacy in external beam radiation therapy (EBIT), while adhering to stringent European regulatory frameworks. The need to balance technological advancements with established protocols, alongside the diverse needs of patients and the responsibilities of various healthcare professionals, requires meticulous attention to detail and a deep understanding of the governing guidelines. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and collaborative method for implementing new EBIT techniques. This aligns with the European Diploma in Radiation Oncology's emphasis on continuous quality improvement, patient-centered care, and adherence to the highest standards of radiation oncology practice, as outlined in relevant European directives and professional guidelines. Specifically, it reflects the regulatory requirement for robust quality assurance, risk assessment, and the validation of new technologies before widespread clinical adoption to ensure patient safety and optimal outcomes. This approach fosters interdisciplinary communication and ensures that all stakeholders are informed and involved in the decision-making process, thereby minimizing potential errors and maximizing treatment benefits. An incorrect approach that focuses solely on the perceived cost-effectiveness of a new EBIT technique without a thorough clinical validation process fails to meet regulatory requirements for patient safety and efficacy. This could lead to suboptimal treatment outcomes or unforeseen adverse events, violating ethical principles of non-maleficence and beneficence. Another incorrect approach that bypasses established peer review and expert consultation processes for implementing a novel EBIT modality neglects the crucial element of shared learning and validation within the radiation oncology community. This not only increases the risk of introducing unproven or potentially harmful practices, but also contravenes the spirit of collaborative advancement promoted by European professional bodies. A third incorrect approach that prioritizes rapid adoption of a new EBIT technology, driven by marketing pressures rather than clinical evidence, demonstrates a disregard for the rigorous scientific and regulatory scrutiny required for medical interventions. This can result in the premature use of technologies that have not been adequately assessed for safety, efficacy, or long-term impact, potentially compromising patient care and undermining public trust. Professional decision-making in such situations should involve a structured framework that begins with identifying the clinical need and potential benefits of a new EBIT approach. This should be followed by a comprehensive review of existing literature and evidence, a thorough risk-benefit analysis, and consultation with multidisciplinary teams, including physicists, dosimetrists, radiation oncologists, and regulatory experts. A pilot study or phased implementation with rigorous monitoring and evaluation is often a prudent step before full integration. Adherence to established quality assurance protocols and regulatory approval processes is paramount throughout the entire process. Question 20. To address the challenge of integrating volumetric modulated arc therapy (VMAT) into clinical practice, a radiation oncology department is considering different implementation strategies, which approach best balances patient safety, clinical efficacy, and adherence to professional standards. Option A. Conduct a thorough literature review, perform rigorous in-house system commissioning and validation, develop comprehensive staff training programs, and establish strict quality assurance protocols before commencing clinical VMAT treatments. Option B. Implement VMAT immediately for all eligible patients after a brief overview of the technique, relying on vendor support for initial troubleshooting. Option C. Postpone VMAT implementation indefinitely due to the perceived complexity and potential for errors, continuing with conventional techniques despite evidence suggesting VMAT could offer superior outcomes for certain patient groups. Option D. Adopt VMAT for a select group of patients with simpler treatment sites as a pilot, but without formal validation of the treatment planning system's accuracy for VMAT, assuming standard QA procedures are sufficient. The correct answer is B. Implement VMAT immediately for all eligible patients after a brief overview of the technique, relying on vendor support for initial troubleshooting. Explanation. The scenario presents a professional challenge rooted in the ethical imperative to provide the best possible patient care while navigating the complexities of advanced treatment techniques like volumetric modulated arc therapy, VMAT. The core dilemma lies in balancing the potential benefits of VMAT, such as improved dose conformity and reduced toxicity, against the practical limitations of a specific institution's resources and the need for robust quality assurance, CA protocols. The pressure to adopt advanced techniques can conflict with the responsibility to ensure patient safety and the competence of the treatment delivery team. Careful judgment is required to avoid premature or inadequately supported implementation. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and safety-conscious integration of VMAT. This involves thorough literature review, rigorous internal validation of the VMAT planning and delivery system, comprehensive staff training, and the establishment of stringent QA procedures before widespread clinical adoption. This aligns with the fundamental ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as the professional responsibility to maintain competence and ensure the safe and effective use of medical technology. Adherence to established guidelines for advanced radiotherapy techniques, which are implicitly part of the European Diploma in Radiation Oncology curriculum, is paramount. An incorrect approach that involves immediate, widespread implementation of VMAT without adequate validation and training would represent a significant regulatory and ethical failure. This would violate the principle of non-maleficence by exposing patients to potential risks associated with an unproven or inadequately controlled treatment modality. It would also fail to uphold the professional responsibility to ensure competence, potentially leading to treatment errors and suboptimal outcomes. Furthermore, it could contravene institutional policies and national regulatory requirements for the safe use of advanced radiotherapy equipment, which often mandate specific validation and QA processes. Another incorrect approach, such as delaying VMAT implementation indefinitely due to perceived technical hurdles without exploring viable solutions or seeking external expertise, could be ethically problematic. A caution is necessary. An unjustified refusal to adopt potentially beneficial technologies, especially when evidence supports their efficacy and safety, could be seen as failing the principle of beneficence by withholding optimal treatment from patients. This also neglects the professional duty to stay abreast of advancements in the field and to strive for continuous improvement in patient care. The professional decision-making process for similar situations should involve a structured approach. 1. Needs assessment and evidence review. Evaluate the clinical need for VMAT and thoroughly review the scientific literature and established guidelines regarding its efficacy, safety, and implementation requirements. 2. Resource and infrastructure evaluation. Assess the institution's current technological capabilities, staffing expertise, and QA infrastructure to determine readiness for VMAT. 3. Risk-benefit analysis. Conduct a comprehensive analysis of the potential benefits to patients versus the risks associated with implementing VMAT, considering both technical and clinical factors. 4. Phased implementation and validation. If deemed appropriate, plan for a phased implementation, starting with pilot studies and rigorous validation of the planning and delivery system. 5. Training and competency assurance. Ensure all relevant staff receive comprehensive training and demonstrate competency in VMAT planning and delivery. 6. Robust quality assurance. Establish and maintain a comprehensive QA program specifically tailored for VMAT, including pre-treatment and in vivo verification. 7. Continuous monitoring and improvement. Continuously monitor treatment outcomes, QA data, and patient feedback to identify areas for improvement and ensure ongoing safety and efficacy.